Hello everyone, I'm Ananya Ghorai. Thank you for joining this presentation. In this presentation, we'll take a look at our alarming cost of healthcare and analyze if newly forming accountable care organizations can indeed address the problem. Let us start with looking at how our national healthcare expenditure per capita has grown over time. As we speak, compared to other nations, healthcare cost in the United States is nearly 1.5 times than that of any other country in terms of GDP. Let us look at the graph. We see over 10% increase in the 80s. Over the last 2 decades, the sequential increase is over 7% year on year. I researched, and my research suggests that accountable care organizations will improve quality of healthcare and reduce cost through close monitoring from federal agencies and by rewarding care providers for outcomes and not for volume of service. Let me reiterate. Compared to other nations, healthcare costs in the United States is nearly 1.5 times than that of any other country in terms of GDP. Industry experts as well as the centers for Medicare and Medicaid services believe that one of the primary reasons is that the traditional healthcare organizations get compensated on the basis of services they provide. If a healthcare organization performs more tests and more procedures, it receives more reimbursement irrespective of outcome of those tests and procedures. This has resulted in high healthcare costs in the United States without any material improvement of quality of care. Both the CMS and industry experts agree that more tests and more procedures do not improve quality of care but significantly increase cost of care. The CMS, in conjunction with industry experts, has developed the concept of accountable care organizations. The ACOs are organizations that will deliver holistic care and will take accountability of the entire care continuum of the population it serves. The ACOs will be paid incentives based on cost savings they attain provided they meet or exceed quality measures. The model of care based on ACO can attain savings of over 5% after providing significant incentives. To maintain and improve quality, CMS will monitor ACOs through several quality measures on the continuous basis. These measures include patient experience, care coordination, patient safety, preventive health, as well as specific measures for population at risk. Population at risk includes conditions such as diabetes, hypertension, coronary, and heart diseases. ACOs will have to meet a minimum quality requirement to be eligible for the incentives. Let us take a detailed look at the cost of care. The Medicare Shared Savings Program provides incentives to accountable care organizations for savings. On the benchmark cost, if the accountable care organization is able to show more than 2% saving, also known as a minimum savings rate, the ACO will earn an incentive of up to 50 to 60% depending on the type of engagement. There are multiple shared savings models. What you see in the table is commonly known as a one-sided model. The one-sided model from the Centers of Medicare and Medicaid Services is the model that is predominantly being used. In this, incentives get capped, typically at 10%, but even without reaching that level, as you see in the table above, ACOs can obtain net savings of 2 to 5%. At an assumed baseline of $89,000, which is the current per capita national expenditure, ACO can earn over $350 per patient, enough for an ACO to participate in the program. ACO incentives are of course contingent upon the quality goals. Let us now take a look at quality of care. In order for an ACO to obtain a share of Medicare savings, the ACO must meet quality standards. There are a total of 33 quality standards across 4 domains. Domains of quality performance measures include the entire spectrum of care. These include patient experience, care coordination, patient safety, preventive health, and specific measures for population at risk. At-risk measures include specific measures for diabetes, hypertension, coronary, and heart diseases. CMS will monitor 33 quality performance measures. Of the 30 quality performance measures, 7 core measures are for patient experience. That is the Centers for Medicare and Medicaid Services. In order to arrive at patient experience measures, CMS obtains information from consumer surveys. The surveys are conducted by the Agency for Healthcare Research and Quality. The comprehensive survey from CMS covers patient demographics, provider information, provider encounter information, including feedback from clerks and receptionists, and many other areas connected to patient experience. The survey provides fine grained information on quality of care standards that ACOs will have to adhere to. Concluding, my research suggests that accountable care organizations will improve quality of healthcare and reduce costs through close monitoring from federal agencies and by rewarding care providers for outcomes and not for volume of service. Independently, industry expert Miles Snowden, MD and Senior Vice President from United Health Group, our nation's largest health insurance organization based on facts from Congressional Budget Office, Centers for Medicare and Medicaid Services, and deep industry knowledge also suggests that accountable care organizations will result in low cost of care and better quality of care. Here are some references. Now, let me answer some questions before I conclude. The first question: how does the per capita healthcare expenditure compare with the rest of the world? In the list of OECD countries, the United States tops the list by spending 17.6% of GDP on healthcare. Compare this with Canada that spends just over 11%, UK that spends less than 10%, Australia that spends just over 9%, and Taiwan and Mexico who spend just over 6%. The next one, that is what happens if an ACO is unable to demonstrate cost saving. Without demonstrating cost saving, ACOs do not get paid incentives. There is a minimum saving rate that ACOs have to attain before they can share a percentage of saving. Although the rate varies by population and ACOs typically have to attain saving of 2% or more. Thank you everyone for attending. Thank you.